Hi, this is Dr. Jason Dulac coming to you from my office in Springfield, Virginia. In my office, I get a lot of questions about children's dentistry or pediatric dentistry, and I want to answer some of those questions here for you today. What is pediatric dentistry? A child in society would be usually up to 18. In dentistry, the jaw stops developing around 12. Most of the adult teeth are in by 12. So pediatric dentistry would be 0 to 12 years old. Your kids will be teething from some kids are born with teeth, it's rare, but it happens, from about 1 to 3. So anytime from they're born up to about 3, they might be teething. By the time they're 3, they'll have their baby molars in and all their baby teeth, which is 10 and 10. About 5 or 6, you'll either start to get the molars in the back, or 6-year molars, those come in without any baby teeth coming out, or they'll start to lose the front teeth. The last study that was done on dental eruption teeth patterns was in the 70s, and at that time, 7 to 8 was average for the front. Anecdotally, most parents will tell you now, and I've seen in my own kids, that it happens a little earlier. So we don't know if that's, hormones in the milk or what it is, but we do seem that kids are losing their teeth a little earlier now. But, I tell parents, kids are, like flowers in a garden. Some comes in at different times. We're monitoring the overall growth and development. Don't get too stressed out about certain age markers. If you have a concern about eruption, come into the office. I'll get an x-ray, make sure all the teeth are there, make sure things are on track, make sure the jaw is developing and on track. Most of pediatric dentistry is about prevention. So up until 3, we don't even polish the teeth. It's just a visual exam, going over home care instructions and diet. So what causes cavities is frequent exposure to sugar and the bacteria in the mouth that, we have bacteria that line our whole digestive tract. The bacteria in the mouth, there's a certain type of bacteria when they get sugar, they make acid for 20 minutes. The acid dissolves the tooth and makes the cavity. So as soon as that baby tooth comes in, you do want to brush it with fluoride toothpaste. If you're not going to brush it with fluoride toothpaste or worried about your kid swallowing too much toothpaste, you can dip the toothbrush in the fluoride mouth rinse. Most kids don't like mint. I recommend an Act, like a bubble gum is a good fluoride mouth rinse that has some good kids flavors. Tom's of Maine has a lot of good fruit flavors, and that's kind of an organic toothpaste, but it still has fluoride in it. So that's a good one too. So my kids love that. But once they have teeth, you do want to brush them with a fluoridated product. Otherwise, if they're really young, you're worried about them swallowing a bunch of stuff, just water, honestly. You don't need to put anything. The kids' toothpaste, there's really no benefit to that at all. So either a fluoride product, which I always recommend for anyone with teeth, or just a plain toothbrush if you're worried you can't, they're going to swallow something. With kids, like I said, either dip it in a fluoridated rinse or take a little bit of toothbrush and toothpaste, put on the toothbrush and just wipe it off. You don't need the big Dairy Queen swirl, on there for the toothbrush. That's like marketing and trying to get more toothbrush sold. So toothpaste sold. So even for adults, they say pea size, I usually put more on, but for kids, I just basically say just wipe it off the bristles, very small amount. Beyond that, it's diet. So brushing would be to get the plaque off the teeth. Most kids have spaces in their teeth. If you go to floss and it's tight and it snaps like it would for an adult tooth, you can go ahead and floss those back molars. That's the number one place kids get cavities is between their back baby molars. But if they have spaces there and you're not sapping the floss, you don't need to floss them. So, maybe once a month, get in there, go in with the floss. If it snaps, start flossing. If it doesn't, you don't need to worry about flossing. So that's to get the bacteria off the teeth. How cavities form: the bacteria in our mouth, when they get sugar, they make acid for 20 minutes. The acid dissolves the tooth and makes the cavity. So it's refined sugar that in the diet that causes cavity. It's not the amount of it, it's the frequency of it. So if you're going to give your kids juice, just keep it to meal times. After juice, other refined sugars, fruit snacks, stuff like that, just keep it to meal times. They can have whatever they want a couple times a day. But between meals, I would keep towards things that don't have sugar in them. Next step below sugar would be pretzels, goldfish, stuff like that, which, my kids love. I'm sure you just do too. Healthy snacks that won't cause cavities: popcorn. Kids love popcorn as long as it's not kettle corn with sugar on it. Fruit, whole fruit has enough fiber in it that the sugar's bound up. It's not refined enough. Very different from juice, even if it's natural 100% juice. Too much sugar in that. So popcorn, meat snacks, cheese. Most kids love cheese, and whole fruit are good options. Of course, veggies, but unless you slither in ranch, they're probably not going to eat that either. When should kids have their first dental appointment? The American Academy of Pediatric Dentists, the ADA, and pediatricians recommend a dental home by 1. From 1 to 3, it's mostly home care instruction, diet counseling, which we just kind of went over, and visual exams. Starting about age 3, we start to polish the teeth. Some kids start to get tartar buildup on their teeth, 10 to 12 range. Like I said, after 12 is usually what we can kind of consider adult teeth. Very critical in that age 6 to 8 range to have a dentist. That's the best time to monitor the jaw growth and development and make sure there's enough space for the adult teeth to come in. We do early or interceptive or functional orthodontic therapy in my office, which is just promoting the jawbone to develop properly. If you get the right appliance at the right age, 6 to 8, you're going to save thousands of dollars in years in orthodontic therapy down the road. So, that old also prevention makes a pound a cure, good for cavities. Also great for saving parents money in ortho down the road. On that note, most pediatricians cannot differentiate between ADHD and sleep deprivation. Anyone who has kids knows it's just they don't get their sleep, they're going to be off. If you hear your kids snoring at all, please give the office a call. The jaw growth and development has to do with snoring. If it's not that, it's either an allergy or the airway might need to be opened surgically. So I'll have a lot of training in that. My daughter actually went through having her tonsils removed and adenoids removed with an ENT. But as you know, if your kid sleeps, they're so much better than if they don't. And there's a lot of behavioral problems at school, ADHD, things like that can be addressed dentally and in conjunction with a dentist, an allergist, and a pediatric ENT that might properly diagnose the problem early enough that you're not confusing ADD and sleep issues into kids. So if you hear your kids snoring at all, definitely give us a call at the office. I'll go over everything. I've got some good blogs on my website about that as well. We do see kids of all ages at the office. We've got a little toy box. Love it. After the visit, just going up, getting a toy. Kids don't like mint a lot. We've got a lot of fruit flavored, fluoride and stuff like that. But if you bring them in early, we just do like lap exam. They know it's a fun place to be. By the time, if we're doing everything they shouldn't get cavities. But if God forbid something happens or they have some trauma, a cavity comes up, at least they'll associate the office with a fun place to be and not some place that they're worried about or scared about. On rare occasions, kids do get bad cavities and we do want to save the tooth. Question I get a lot from parents, even some of my friends who are medical doctors is, why fix cavities in baby teeth? So cavities are caused by one type of bacteria. From the time your child's about 6 to 12, they're going to be in what we call transitional dentition, where they have some baby teeth and some adult teeth. So to prevent the adult teeth from getting cavities and to keep the adult teeth coming in properly, we need the baby teeth healthy. If there's cavities in baby teeth, they're going to get cavities in the adult teeth. If the baby tooth is taken out, the adult tooth's not going to come in right. So it is important to keep the baby teeth. It is important to keep them healthy. On rare occasion, they'll get a big cavity that goes into the nerve. If that's the case, or if your child needs sedation, I work with a lot of great pediatric dentists in the area and get that taken care of for you. But if we can save the tooth, we want to save it. If your child chips a tooth, my daughter's got a chipped tooth, not a big deal. Give us a call. If a baby tooth gets knocked out, you leave it out. If you're not sure if it's a baby tooth or an adult tooth, put it in some saline contact solution. If you don't have that, milk, bring it in, I'll take a look at it. But if a baby tooth comes out, we just leave it out. Adult tooth, if it comes out, it's best to just pop it back into place as soon as possible. So if they get those big adult teeth in the front, they got a baseball game or whatever, they catch an elbow, tooth pops out, just pop that puppy back in as soon as possible. The sooner we get it popped back in, the better. Give me a call if you have any concerns. Nowadays, FaceTime and things like that. I can kind of guide you through stuff if emergency happens after hours. But for small chips, baby teeth, a lot of kids don't want to sit in the chair for bonding. I'm happy to do it. But if it's not sensitive to them, it's not bothering you, it's not a concern to you cosmetically, sometimes a small chip will just leave. Baby teeth tend to be bright white. So if you're seeing anything dark in there, that probably is decay, unfortunately. Do give us a call at the office. We can get that taken care of before it becomes a bigger issue. At my office, we have laughing gas or nitrous oxide. I recommend it for all kids doing any type of procedure, filling, things like that, extractions if needed. Sometimes kids have to have baby teeth out that get stuck in, like for orthodontic reasons or to promote development, even if they're healthy. So we do have nitrous oxide or laughing gas at the office, both for adults and kids. If that is not enough for your child to do the procedure safely, I'll get your referral to a good pediatric dentist that has hospital privileges in the area that can put your kid under general anesthesia and do whatever they need to have done. Safety is the most important thing. So if I don't think I can work on your child safely, I'm not going to do the procedure. I'll stop. We'll get it referred. I always give numbing. Most of my adult patients were traumatized as kids. So I hope I see a day in my practice time where that's not the case. But no matter what we do, we're always going to give numbing to the child. If you'd like to schedule an appointment for your child or have any questions about your child's dental growth and development, check out our website, dulacdds.com. Give us a call at the office, 703-451-4500. We'd love to see you guys at the office today. Thanks so much.